everyone, hi, how are you? Welcome to Raleigh Pharma. This is World's Best Doctors channel, and if you're new here, guys, hi, how are you? Linda Opanga is my name. I'm a practicing pharmacist in Kenya, by the way, and in this channel I talk about health, I talk about pharmacy practice and about your medicine. So sorry for the inconsistency, and if you're new here, please guys hit the subscribe button. We are growing, and share these videos. So today I'm continuing with the series of Ask Your Pharmacist, and I have a medicine here today, by the end. Disclaimer, this is only being used for educational purposes. I am not in any way promoting any brand. So today's topic, as you can see, we are going to talk about a patient information leaflet. So you go to the pharmacy, you buy your medicine, and then you're given the medicine in a pack. And then once you open the pack, let me just remove, this is an inhaler. Once you open the pack, now I'm gonna concentrate on this insert that comes with the pack. Yeah, so this is what we call a patient information leaflet, and as we have seen, like as per the name, this is just a leaflet, if I may say, which contains the information that is necessary for drug administration, that is necessary for the patient to know. When you go to buy medicines at the pharmacy, make sure you ask for this patient information leaflet. To talk about why the patient information leaflet is important and why it is necessary for you as the patient to have this and to read and to go through this. So I'm just like starting with the demonstration. You can see this one is so big, this is big, but then there are some which are usually like very small, some very tiny. So it depends on actually the packaging, it depends on the type of medicine. So for this, I want to encourage like you as the patient to be going through this leaflet, because this is what it contains. Number one, it contains the name of the medicinal product. So for example, this one, it's an inhaler which contains salbutamol. So this patient information will even exactly tell you what this medicine is to begin with, both the trade name and both the name of the active ingredient, which is what you're actually consuming. Then the second thing that it will tell you about is the composition. So it will tell you like this medicine contains the following things. So now you'll be able to know that this medicine that I'm taking contains this, and it's important for you to know what your medicine contains, because some medicine contains excipients or additives other than the active ingredient, which most patients, or some patients, not even most patients, some patients can be allergic to, or some patients can get reactions to. So it's important that you read through. For example, most medicines contain lactose, and most people are lactose intolerant. So if you read through this, you'll be able to know like, hey, I'm lactose intolerant and I'm not going to take this. Can you please give me an alternative which does not contain lactose? The other thing that it contains is the indications. By indications, I mean what this medicine is going to be used for. So you read this medicine, okay, scenario, some people just come, they go to the doctor, they don't even know what they're suffering from, especially like the old people and the children. So you don't know what this person is suffering from, and then they just give them the medicines, and then they tell you 2 times 3 or something like that. So when you take this leaflet and you read, you as a patient, you'll be able to know like, this is what I am suffering from. You'll be able to understand what you're suffering from better, how the disease is, and how the drug is even helping you to manage the disease. And also you might just know what also this medicine can be used for. And this is not for abuse, but it's just you to have knowledge about like your medicine, because yeah, truth be told, sometimes we go to the pharmacy, though it's our duty as the pharmacist to take time and educate patients, but reality on the ground, yeah, you can go to some pharmacies in town, you get very long queues, or even in hospital, very long queues, and most times, like when they're working, that person will not even take a lot of time with you. Like the pharmacist or the pharmaceutical technologist will not have much time for you, though they're supposed to explain to you everything. So it's upon you now to go read this leaflet, because it will tell you more about the medicine, more about what even you're suffering from. Then the other thing that you should know, like what comes in this leaflet, is the dosage and the method of administration. So for instance, it will tell you like this inhaler, these are the steps. For example, for this inhaler, they've clearly indicated like the steps that you're supposed to take when using this medication. So if you read through this, you might be able to know, like, this is how I'm going to, you'll be able to know that this is how I'm going to use the medicine. If it's a tablet, it will tell you for an adult, you're going to take this and this and this, though the pharmacist will have explained it to you. But if you read this, you might just get like more information on how to do it. For example, if maybe your medicines were delivered like through an online pharmacy and it has the leaflet, and maybe you're not able to communicate well and get the instructions, you can come and read here, or you can even call back the prescriber, call back the pharmacist and clarify. But if you read this, yeah, you might just get more information on it. Then another thing that it contains is now warnings. So warnings, it means that this drug might cause the following effects. There's something called like black box warning, so you can get them on some medicines where they indicate clearly that this drug will cause these effects, so that if you're experiencing some of these effects, then you might be able to know that this is as a result of this drug, and this is what I'm going to do, and I want to report this now to maybe the Pharmacy and Poisons Board, report it back to the prescriber or something like that. So this will give you a clear indication on the side effects, on the warnings. Also, to touch on side effects, maybe in case someone suffers poisoning, maybe there's a baby in the house, the baby has taken the medicine, so it will tell you exactly what you can do, maybe some first aid measures. Some medicines, like some leaflets, they usually have that, like, do this in case of poisoning, do this. So this is really like important for you to read and just know what exactly it says about effects. Another thing that it will tell you is in conditions such as pregnancy and lactation. So if you're a pregnant mother and you've been given this medicine, if you're breastfeeding your baby and you've been given this medicine, then you'll be able to read through and understand, like, this medicine maybe is excreted in milk, and I'm supposed to maybe not to I'm supposed to express this before I take my medicine. So because if I take this medicine like this, it might affect my child or something like that. And in pregnancy, you might just be able to know that, is it safe in pregnancy, is it not safe in pregnancy, details about pregnancy. In case you want like clarification, you can just come here. Then another thing it gives us is drug interactions, drug food interactions. So this clearly will indicate for you, like, if I take this medicine with this, then maybe with grape juice, if I take this medicine with this, then these are the effects that are going to occur. So it will give you, like, avoid this while on this drug. For example, a common thing like metronidazole, avoid this when you're on alcohol, avoid this when avoid taking this medicine with this, avoid taking this with this type of food. So this will clearly give you an indication of what you're supposed to avoid when you're on that medicine. So this really is rich information that I'm sharing it out to you. Then I'm trying to see any other information that I might have left out. Yeah, so even for the pharmacist, it can give you, for the medics, for the pharmacist, this can give you a clue on the pharmacological action of the medicine. So you'll see, this is how the medicine is going to act, like, this is how the medicine is acting in the body, this is how my body is reacting to the body in terms of the absorption, the distribution, the metabolism, the excretion. These leaflet informations have all this information. So if you are a prescriber also for intravenous and intramuscular injections, most of them usually highlight a procedure on how you're supposed to reconstitute this medicine before you even like inject someone. Also for suspensions, for babies, it gives you the procedure, like reconstitute up to this line, put water up to this line, shake it well, do this before you even administer to the patient. So another thing, let me just look at it, because I just want to show you what is here as I talk to you about it. It can also show you now the expiry date of the product. This shows some, for example, sometimes, yeah, you can be given in a box and then maybe the box has the expiry date, you lose the box. So if you come to refer to this, it will tell you that this medicine is expiring after this long and you can discard it. Also, another thing that is indicated there is the storage conditions. Yeah, this happens in mostly cold chain products. By cold chain products, I mean these are products that you're supposed to store in a refrigerator or in a freezer, depending on the type of product. So this will also this will indicate to you like, hey, I'm supposed to store this medicine in these conditions, so that I may preserve the quality, the safety and efficacy of the product through good storage practices. Also, for common medicines, it will tell you do not store above 30. Do not store above 30. This means that in places where it's hot, like the kitchen, avoid such places. Clearly indicate to you the correct storage procedures for your medicine. Or a medical device, it will give you the steps for cleaning. Like this one clearly indicates how you're supposed to clean this product. So I will like remove this cap, use the inhaler, and then just put it back. It gives you ways in which you can actually clean this in order to avoid infections. So read this, go through it, and then lastly it will give you the details of the manufacturer. So details of the manufacturer or distributor are important, because this will help you now get channels of communication, so that in case that you suffer any effects, you know who to communicate to, either the pharmacy or just Google details of the distributor, then you can communicate with them. About the patient information leaflet, it's my work to come and give you information about what you need to know about your medicines. So in case you have any questions regarding your patient information leaflet, please let me know in the comment section, and I'd like to encourage all of you, please make use of this information that comes with the drug. Don't discard. Whether you're a professional or whether you're a patient, go through it, because it will give you more power, it will give you more information about your medicine. So thank you so much guys for watching. I hope this video was helpful to you. So make sure you like, leave a comment in case you have any question in the comment section, share, and please subscribe to my channel. Thank you so much guys, and I'll see you on my next video. Bye bye.